Hello, my name is Dr. Daniel Goldman. I'm a board-certified doctor of internal medicine, also known as an internist. What is an internist? An internist is a doctor who takes care of a wide variety of medical issues for adults 18 years and older. During these challenging times of the coronavirus-19 pandemic, I'm going to try and help educate you on how to protect yourself from acquiring the virus. The virus is spread by one of two chief mechanisms. One, by inhalation from virus particles in the air. This can occur by being in close proximity to someone who is not yet symptomatic but is still shedding virus in their respiratory system through talking or even just breathing. It can also be spread much more easily by being around someone who has symptoms such as coughing or sneezing. The second way of acquiring the virus is by touching a surface that's contaminated with the virus and then touching your face, either your eyes, your nose, or your mouth, and then getting it into your body that way. The virus can survive up to 3 hours once it's been aerosolized in the air through sneezing or coughing. It can last up to 4 hours on copper, can last up to 24 hours on cardboard, and can last up to 48 hours on stainless steel, and as long as 72 hours on plastic. The best ways to avoid contracting the virus are 1, social distancing, which includes staying at least 6 feet away from people in public areas and going out in public only when essential for essential activities such as grocery shopping. 2, frequent hand washing. Wash your hands for at least 20 seconds with soap and water and drying thoroughly after you've come in contact with a contaminated surface. If soap and water is not readily available, then using an alcohol-based hand rub would be a good second-line treatment until you get to a sink with soap and water. 3, wearing a mask if you're having symptoms such as coughing or sneezing, and isolating yourself from others to avoid spreading the virus to uninfected people. Cough or sneeze into your elbow instead of your hand to avoid spreading the virus to other surfaces. Wearing a mask in public spaces such as a grocery market is a good way to avoid contracting the virus as well. However, medical grade masks are not necessary. And finally, wipe down frequently touched surfaces with a disinfectant that is active against viruses such as Lysol or Clorox bleach, but be sure to follow the directions on the bottle so as not to injure yourself with these cleaners. And lastly, stay safe.